The ward held 22 beds that winter. They were always full. The physician moved through it with his clipboard the way physicians moved then, with the measured economy of someone who had learned that attention is a finite resource and must be allocated with care. He stopped at the first bed, read the notes, made a mark, moved to the second, read the same notes, made no mark. He moved on. Both patients presented with the same complaint and progression. The difference between them was a single line in a protocol he had written 6 months before. The line was not arbitrary. He had written it for reasons that were defensible then and remain defensible now. The trial required a specific population, controlled, narrow, and consistent, so that when the results came in, they would be clean, unmistakable, the kind of evidence that changes practice. Exclusions were not cruelties. They were the methodological price of internal validity, and he had paid it deliberately. The trial was completed successfully. The results were published, cited, and built upon. The excluded patient received the standard treatment, insufficient as it turned out, but this was not recorded as a failure of the study. It was simply outside the study's question, which was exactly what the protocol had intended. The study had worked as designed. Decades later, a researcher compiling a systematic review worked through the same literature, reading, extracting, and noting the study populations. In the fourth paper, an exclusion criterion matched the third. In the seventh, it matched again. In the 12th, she stopped. The same exclusion had appeared in every foundational study in the field, not because each researcher had reasoned it independently, because each had started from the one before. None of the subsequent studies had independently justified the exclusion. Each had cited the previous design as precedent. The original criterion had been written for internal validity. The copies had been written from habit. The error was not replicated. The assumption was. And with each citation, it became less visible, not more justified. The first study had rigorous methodology. It had simply never asked whether the question it was answering was the right question or just the cleanest one available. The protocol decided who counted as evidence. Nobody had named that a decision.